It may be an awkward conversation, but doctors are very familiar with discussing sexual dysfunction with their patients. Chief among them is ED, which is a fairly common condition that becomes more common with age. Here's the latest in this week's Positively Healthy. It's a touchy subject that many men would rather avoid, talking to their doctor about impotence.
Erectile dysfunction is a really widespread issue, and we actually underestimate how many people actually are affected by it.
The truth is, about 50% of men over the age of 50 have some degree of ED.
One of the challenges is kind of quantifying it. So some men have a mild form of it, some men have much more severe forms, and then there's stigma to it, and they don't want to talk about it, or they're embarrassed by it.
Board-certified urologist Alexander Rosen says there are many options to help men manage this condition, but they can't get help if they don't ask.
And there's typically a stepwise approach to moving through how we treat it. So the most convenient is oral medications, the things that we've seen on TV, Viagra, Cialis, Levitra, there's a few others. That tends to be the most convenient. It can work well for a lot of men. It doesn't work for everybody. And then we move through the spectrum of therapies.
The treatment progression includes vacuum erection devices and injectables, some of which are better suited to patients with underlying medical conditions.
As you move to some of the other therapies, patients who do have cardiac comorbidities, heart problems, can still get them. So there's like injectable therapies are very specific to really the area being treated and aren't as systemic. And then the prosthetic surgery is probably one of the ideals for those patients if we can control their surgical risk factors.
With proper therapy, men can greatly improve their quality of life without ED getting in the way. So there's nothing to gain from the silent treatment.
I think it's important that those men know that they're not alone.